our Kansas Text4baby mini-grant webinar. To start off with, I just wanted to make sure that we have our audio situated. You can have your choice of participating in the webinar either over the phone or via your computer with your mic and speakers. If you are listening over the telephone, please make sure you have the telephone option selected. Otherwise, it will be very staticky and you won't be able to hear very well. But it's fine to listen over your computer as long as you have the mic and speakers part selected. So hopefully everyone has the audio. If you have any technical difficulties or questions as you go, you can feel free to type in to the chat or question box, and I'm going to talk about that in just a moment. Just for those of you, I know most of you have used GoToWebinar before, but if you have not, then I just wanted to make sure we went over a few just simple pieces that are available to us. So like I mentioned, here is the audio. You click on the plus button. You can use mic and speakers. It says do not select mic and speakers, but of course do not select mic and speakers if you're using the telephone. And then there is a number and an access code, and it should send you an audio pin as well so that you can ask questions at the end. There is a question in a chat box down at the bottom of the screen, and we will be monitoring these as we go through the webinar, so you can feel free to type in a question. We will have time for questions and answers at the end, but we will give you the opportunity to type in questions as you go so that you don't forget your question by the end of the webinar. So we will keep track of those and monitor those, and we'll answer those as we receive them. You can also, if you see the red arrow at the top, that will, if you hit the red arrow, that will give you a full screen. It will remove the control panel for GoToMeeting. So if you would like to have a full screen view, you can do that as well. And there's also an opportunity for polls. And this is just an example of a poll. And so you would select an answer and hit submit. And we're actually going to do some polls today during the webinar. We're going to get kicked off with a couple of polls here. So our first poll is, I represent the following type of organization. And so I'm going to go ahead and launch this poll and give you just an opportunity to answer these. So if you could go ahead and click on which organization you represent. It looks like many of you have voted. I'm going to give you just a few more seconds here to go ahead and complete the voting, and then we will share those results. And for those of you who are other, then I would ask that you type that into the box. So it looks like most of you have had the chance to vote. I'll give you just another couple of seconds. I know it's a Monday morning. Okay, so I'm going to go ahead and close the poll, and then I'm going to share the results. And sometimes when I share the results, our presenters can't see the results. And so it looks like 43% are representing county health departments, 21% early childhood education or other programs related to early childhood, 14% community coalitions, and 21% other. And so we welcome all of you on the webinar today. We are glad you're here, and so I am going to go on. So our next poll is, we have been promoting Text4baby in our community prior to the mini-grant program. So I'm going to go ahead and select this poll and give you a chance to respond to that. Okay, great. Looks like 47% of you have participated in Text4baby before, and 53% of you have not. So we're really excited actually for both. For those of you who have been, we hope the mini grants are an opportunity to re-energize your efforts. And for those of you who haven't, we welcome you aboard. It's a great campaign. You're going to get an opportunity to hear more about it and hopefully get some great ideas to move your work forward. So with that, I am going to turn it over to Lindsay Handelsman, who is with National Healthy Mothers, Healthy Babies Coalition and the National Text4baby organization. And so she is going to provide you some great information that's really going to help you move your campaign along. So just give us a moment here while we switch screens, and then she is going to share the information with you.
Great, thanks, Cristi. Appreciate the introduction. As Cristi mentioned, my name is Lindsay Handelsman. I work at the National Healthy Mothers, Healthy Babies Coalition, where the Text4baby program is housed. And I work with 19 states all over the U.S. and supporting Text4baby outreach efforts and working with a number of our partners and thinking of the ways that they can integrate and promote the Text4baby service and the work you all are doing. So this is really neat that we were able to do that poll because it shows that there are some existing partners that are participating in the mini grant opportunity as well as some new partners. So I welcome the new ones on board as well as welcome back and continuing efforts for those of you who've already been partners. So I will talk about Text4baby as far as for those of you it might be just an opportunity to get a refresher about the service, and for those of you who are new, you're going to learn a lot about the program and who's involved. At the end of the webinar today, you'll have the opportunity to ask questions, so definitely keep some questions in mind. If there's anything that comes up while I'm presenting, feel free to type them in the question box that you see on your screen, as well as, so it seems that the question box will be here if you see my screen right now. And you can type it in if you have anything that you're interested in, and we'll be sure to answer your questions at the end. So I will get going. Doesn't look like I'm able to switch the slides again, so I'm going to go out of this mode. 1 second, sorry about this. Yeah, it doesn't look like I can switch it, so I'm just going to show the slides in this mode. Sorry about that. So the Text4baby program. So again, some of you might be already familiar with the service, but just to give you an overview, the Text4baby service is a free program based at National Healthy Mothers, Healthy Babies Coalition. Our founding sponsor is Johnson & Johnson, but it really is a private-public partnership made up of a number of different organizations and agencies that were integral in launching the program over 3 years ago. White House Office of Science and Technology, Department of Health and Human Services, as well as a variety of others. Over 1,000 partners to date are involved in promoting the service. It is the largest national mobile health initiative, reaching over 580 moms since launch, and then specifically in Kansas, we're reaching over 8,500 moms. Just to kind of give you some Kansas-specific information, and there's a lot more moms that hopefully we'll be able to reach soon. So the Text4baby service, it provides free text messages to pregnant moms and moms with babies under the age of 1. The messages are health and safety information timed to where the mom is in her pregnancy, as well as after she has the baby up until age 1. We want every mom enrolled in Text4baby, but specifically we do focus on reaching lower income, young women, those with having lower access to health care or no health care at all. We really want to encourage women to get this supplemental information through Text4baby and encouraging them to speak to their providers. So a little bit more about how the Text4baby kind of came together. So why did we decide to go mobile? Well, here's just some really interesting data around text messaging and cell phones. 89% of young women have cell phones. 99% of text messages are read, and then 90% are read within 3 minutes. I mean, clearly, just by that data, I mean, it resonates so much with me and the staff here, and why this whole concept of mobile health and bringing in a Text4baby concept in the United States came to be is here's a tool. Here's cell phones that women are not only using, they're using it personally, but also to gather information. So we thought, wow, this is a great opportunity to communicate messaging through a cell phone. People of color are more likely to text than their white counterparts, as well as lower income Americans text more than higher income adults. Both very important data points just to reinforce why this model is really a great tool to reach specifically the population that we want to be reaching. So I focused a little, I have some slides in here around the WIC community. I know you all work with a broad range of different clients and patients and women, but just to kind of give an example, for those of you that it seems like about half of you are working in some sort of health department organization, thinking of involving the WIC community has just resonated as a really good way to reach moms, and there's just some ideas that we give around WIC that can be applied to any type of organization. I'll give a number of ideas in general what our partners have done, but just to show you just moms that are attending WIC again are kind of our focus population. So just looking at WIC moms and technology, over 8,000 moms participated in a survey, and through this survey, text messages proved that it was the top 3 technologies used by these moms. Over 90% own cell phones, over 93% are texting, as well as other data showing that, again, just a really great way to be reaching moms. So who are we? Again, Text4baby, it's based at the nonprofit Maternal and Child Health Organization, but it involves Johnson & Johnson as our founding sponsor and supporter. CK, the Wireless Foundation, provides the funding to support all of our text messages to make them free to the end user, as well as we are very actively engaged with Voxiva, who is the technology company that does everything technology related with sending out the text as well as Department of Health and Human Services, White House Office of Science and Technology, and a number of others were integral in making the service as well as keeping it going. So how does it work? Again, this might be a refresher for some of you, but it doesn't hurt to hear it again, just to make sure you really understand when you're going out into the community. Not only do you understand how to tell somebody, but you can actually show a mom. A lot of the times when we're in the community or partners in the community, a great way to just make sure that people are signing up is just walking through the process with them. So whether you're in a clinic or a health department or a community event or however you're planning on promoting the service, it's just a great way for you to feel comfortable so you can explain it. So how you sign up, you text baby or bebé for the Spanish version to 501-411. Mom then gives her due date or date of birth if she's had the baby, as well as a zip code. Mom then gets free 3 text messages every week throughout pregnancy and then until baby's first birthday. The service 3 years ago started off as a one-way health communication program, providing women with this information they need to keep mom and baby healthy. As we've moved on over the past 3 years, we've realized, wow, this could be a really great way to have some sort of interactivity, and we've gotten feedback from users and our partners. Clearly, we have over 580 women, or dads, or moms, or grandparents have also signed up, but mainly moms, who have given us feedback saying, they really enjoy the service, it's very helpful, but if there's any sort of interactivity that we can do. So back in fall 2010, we implemented a flu extra set of messages that moms could get, where we asked moms if they had received a flu shot, and if not, were they interested in getting reminders around getting a flu shot. So we got such a great response rate that it showed us, wow, moms are reading these messages, these topics are important to them, and they're responding to us. So since then, we've tried to add in a little bit more as far as more information around Medicaid and CHIP. We have some quizzes. We also send out the ability for moms to do appointment reminders is a really neat feature that we've added into the service. So at any point, anybody enrolled can set up multiple appointment reminders and set up the date and the time, as well as they can give a little description as well. And then, we've added in, we've always had this, but just more and more urgent health alerts when we need, in addition to the 3 messages that we send out, and I'll get more into that in a second. So here's the variety of topics we cover. When we're developing our messaging, we do the best we can to balance the topics and the number of messages we feel is really important to communicate to our moms. So anything from smoking cessation to breastfeeding to healthcare access, diabetes, nutrition, and then you see the variety of other topics here. So how we develop the messaging, We have a content council, which is made up of the number of major medical associations you see here: American Academy of Pediatrics, American College of Nurse Midwives, American College of Obstetricians and Gynecologists, and then you see many more here. Once a year we do a huge overhaul and make sure we look at all the messages with our council, making sure they're relevant, always evidence-based, exactly what our moms in the community that are enrolled want to hear, need to hear, and we're very receptive from our users as well as our partners about updating and keeping our messages just relevant and in what we need to be communicating. As well as throughout the year, we definitely have an ongoing review of the messaging. So if anybody contacts us and says, this is a really important issue or this is a new guideline, we're definitely open to hearing feedback, and we like to hear that feedback both on not only the national level, but we have state partners that are experts in certain topics, and we'd like to get that feedback as well. So this is a really important process within developing the messages, and we're sure to just always be making sure we're staying on top of current issues in maternal and child health. So like I mentioned, in addition to the 3 messages sent out every week, we also send out alerts, or we call them ad hoc messages, whether it's newsworthy maternal and child health topics, recalls, outbreaks. So for example, the first bullet, there was a Tylenol recall in May 2010. We were able to utilize our user base and send out messages about the Tylenol recall before even it hit major media markets. So it was a very effective way to communicate to our moms. We want to be sure we're getting this information out. Second to last bullet, there was a pertussis outbreak back in April 2012, and as well as in June 2012. We were able in April to target the 7 states where there was the pertussis outbreak and send an ad hoc message saying, giving information around pertussis. So again, really interesting and kind of effective way that we can utilize the tool and enhance it even more to get information to our moms. So again, as I started to mention, we've tried to enhance the service over the past year and make it a little bit more interactive. There's about 267 messages total. 58% contain additional help and resource information. 46%, or about 123 of them, contain mobile pages. These mobile pages are developed with our partners that are experts in a variety of topics, and some of those include links to videos or links to additional websites where the user can get some more information. Again, like I mentioned, there's appointment reminders. We have messages that link to a variety of external websites and phone numbers and a variety of other resources. So here's an example of one of the mobile pages, and this is on our 39-week topic. So just kind of giving moms information about how important it is to let baby grow, to the 39-week period and let baby come out when they're ready. Just information around what happens, when you can let your baby grow to this point, and then showing the video that Marcia Dimes did, one of our key partners, and on their site there's some additional information around baby's development. So again, I kind of just highlighted some information in the WIC realm and nutritional messages, but this is just one topic. I mean, here's just some examples around some of our messages we have in the nutrition issue, and one is you need calcium to build your baby's teeth and bones. Good sources of calcium are low-fat or fat-free milk, yogurt, and hard cheeses like cheddar. Just one example of one of the messages we send out. So again, in this slide is talking about WIC appointment reminders, but really they're appointment reminders for anybody. Just right now, when we've worked with some of the WIC clinics, we've been able to follow if a user signed up at a WIC facility, they could actually text in WIC when they're asked to give a participant code, just so we can track them as WIC. But any user, if they're not WIC, this doesn't apply to them. And then the steps 2 through 4 is how any user can sign up for an appointment reminder, which they would just text remind to 501-411. They would then be prompted to give the appointment date as well as a short description, and then that participant will receive an automated message, as stated here, and they'll receive the reminder 3 days before as well as the morning of the appointment. So again, we're getting a lot of great anecdotal feedback around the appointment reminders, and we're really looking forward to understanding if these were effective and kind of what our partners and users have been saying about them. But we've been happy to include this in our service. So who's involved in Text4baby? As I've mentioned, we have more than 1,000 promotional partners around the U.S., federal agencies, local and state health departments, many of you on the call, hospital networks, Medicaid agencies, health plans, nonprofit organizations, media partners. So we run the gamut of who's involved in this program, who's promoting us. And again, we really like to, as we're talking with our partners, to not think of it as an additional program that they have to add to the many responsibilities that you all are working on, but think of it as just another way to supplement and help the work that you're already doing. It's just another tool to communicate the messages that you're already trying to get across to the moms that you work with in the community. So just I wanted to include this for a number of you, that work, whether it's at a health department or something similar, just to reinforce we have this very strong partnership from the beginning with Health and Human Services. But back to last February, so I guess over a year and a half now, we announced our partnership with the Centers for Medicare and Medicaid Services. And this was to really just continue to enhance the messages that we have in our service around Medicaid and CHIP, and just getting the word out about driving our users to find out more information around free and low-cost health care. So again, I keep mentioning this. We have deep partnerships with major medical associations as well as state affiliates of these associations, and we're just excited to continue. We've been trying to reach out to the state affiliates more and make some of these connections. So keeping this in mind as you all are doing outreach, thinking of American Academy of Pediatrics and American College of Obstetricians and Gynecologists and a number of these other, March of Dimes, number of these other major medical associations. It's very interesting and a really good strategy to be able to connect with them and possibly find out about priorities and other strategies they're working on and possibly work with them to integrate Text4baby. Nationally, we have a lot of support. AAP and ACOG and AMCHIP send out information to their affiliates all over the U.S. And then, we try to even go further down, and I'm trying to connect with a number of our state affiliates with these major medicals. So again, just another idea to keep in mind that if you have any connections to any of these state chapters or affiliates, it's really advantageous to kind of include them in the work that you're going to be doing. Social media presence, we're very active in social media. We have a robust website that has a very high user presence, as well as we have expert testimonials that talk about what our experts think about and their information around Text4baby and their utilization, as well as what users have gotten out of the service. So we've been trying to enhance our website and add more testimonials. As well as many of you are familiar, we have a Text4baby Tuesday e-newsletter that goes out every Tuesday. For those of you that are new, I highly encourage you to sign up for Text4baby Tuesday. It's a great way to learn about new features. For example, we just added the appointment reminder feature recently, as well as we like to bring visibility to what our partners are doing and the work they're doing. So recently, we featured this mini-grant opportunity in the state of Kansas. We're very excited to share this with our other partners, whether it gives them an idea to do something similar in their state, as well as we just like to highlight different ways and success stories of what our partners are doing to get the service out to their patients or clients. So if you have any great ideas you want us to feature, please feel free to reach out to me, but also just a great way to stay in the loop about what we're doing nationally and just different ideas for partners. We have a very large Facebook presence targeted at its consumer facing, so this is trying to engage users beyond just participating in the service, as well as Twitter engagement. This is mainly for our partners, and just kind of in addition, very similar to information we include in Text4baby Tuesday. So if any of you are involved in Twitter, you can retweet or get involved and follow us there. So here's just a picture. It's fun to show this, a variety of ideas and ways that our partners are promoting the service in the community. The top left picture shows a community event that took place at a local Walmart, giving out the free materials we have available. The picture in the center on the top is actually a flash mob that our partners did in Nevada outside of a minor league baseball stadium. Very creative. New moms, pregnant moms came out and did a little dance to a Justin Bieber song. So very creative way to showing Text4baby in the community and getting people interested. Top right, we've had a number of partners create banners. They've, through grants or funding that they've gotten, it's very easy to promote the service, completely without money, just incorporating it with the free materials we have and just, in tandem with your initiatives that you currently work on. But if there is additional funding, for example, like what you're getting the opportunity to do with this mini grant, it's neat to think of these other ideas. So doing, the billboards like you see in the bottom right or the top right with the bus ads, just other ideas of how partners have promoted it. I really like the example in the bottom right too, because it shows a dad. Usually a lot of materials clearly targeted mom, but we want dads also involved. We definitely encourage dads to sign up and get information. We've even added in a few text messages and some information for dads specifically, so that's been an exciting feature. And he had a local DJ out in San Diego that was involved in the beginning. So just a neat idea as you see here. So part of signing up and doing a proposal for the mini grants in Kansas, you all, new partners or existing partners, you were already a partner with Text4baby, but you've probably seen what you get as far as now that you all are partners. But just to go over again, there's no cost. All of our resources are free and available to you all. Some of our resources that are available on our website include flyer art, tip sheets, boilerplate language, press release templates. So keep this in mind as you're promoting and getting the word out within your community. All the services available in both English and Spanish, as well as our promotional materials are as well. You will have access to the Text4baby logo, as well as Adobe InDesign art files for customization. So any of the materials that we have, you do have the ability to customize that and put your logo on them. And I can work with you and send you the customizable files, and you can put whether it's your health department or whatever organization you work with, and then that you can distribute that in your community. As well as, again, you can order kind of the national standard versions of our materials at any point that you can hand out as well. You will, in addition, have access to zip code level data to track enrollment. Cristi will talk about this a little bit more later, but they'll work with you in kind of looking at the data and assessing enrollment throughout the state. But if that is something you're interested, you can also track your enrollment by filling out a data use agreement. And you can see, for example, if you have a community event on a certain day, you can go into our portal once you've filled out this data use agreement, and you can look to see if you happen to have higher enrollment on that day, and showing that it was probably correlated to what you did at that event. Again, we really want to promote you all on Text4baby Tuesday. You will get technical assistance from myself. I'm the Kansas Outreach Coordinator, so you can reach out to me anytime. I could provide, whether it's just brainstorming ideas to, again, the Text4baby logo and ideas for customizing some sort of design or resource that you want to provide. Again, recognition on our website. And then a really neat way, opportunity to connect with your peers. This is a really neat way to get in touch with, currently I think we're up to 38 partners in Kansas. This mini grant opportunity, there's so many new partners that came in through this. So really neat way to connect with others around the state that are doing similar work. So I wanted to talk about, we are currently fully in the state enrollment contest. This is the third year that we've done this. It was launched on May 12th, and it's going to go until October 21st. The state enrollment contest is a contest to revitalize efforts in our state to just get partners excited about promoting the contest, both in new creative ways, or promoting the service, excuse me, and new ways. And we've divided up our states into 3 categories. As you see, I bolded Kansas right over here. You are in the medium state category. I think currently right now Kansas is right in the middle of your standings in the medium state. There's a lot of room to kind of beef up your numbers, and I think with the promotional activities that you are about to participate in, it's really going to help where Kansas is. So I look forward to seeing every week we announce our weekly winners in each of our categories, as well as at the end we're going to have an overall winner that we're going to announce in conjunction with the American Public Health Association annual meeting at the beginning of November in Boston. So it's really neat to just strive for becoming a weekly winner and bringing visibility to the work you're doing, as well as, I think this is neat having so many new partners working with the grant funding that you all will be receiving. I think it's really going to help Kansas. So I'm excited to see how well you do. And again, I'm here to support you and giving you ideas and the resources you need to promote. So just again, I just focused in on some ideas within like the WIC community, and we've had a lot of success recently. Just to give you some ideas, in New York, the Neighborhood WIC of Public Health Solutions in New York has really stepped up how they're promoting Text4baby. So many of our partners are involved. They disseminate materials at events, in their clinics, at hospitals, in a variety of settings. Well, what this Neighborhood WIC of Public Health Solutions did is they really just did a full integration. So they implemented in-depth training for all client interacting staff, particularly breastfeeding peer counselors. Strong emphasis on enrolling on site. So every patient that's coming into the clinic, they're talking about Text4baby, they're wearing Ask Me About Text4baby pins, enrolling their clients right on the site, as well as really incorporating the appointment reminder feature. So once that patient is enrolled or that client is enrolled in Text4baby, they had a creative idea of putting stickers on that client's file showing that, okay, this client is enrolled in Text4baby, and then at every appointment, enrolling them and using the appointment reminders to get them back to their appointment. So it's helping the WIC clinics keep their women, coming back to their appointments, as well as engaging them within the Text4baby service too. A number of our users have said they have felt empowered to talk to their providers about different topics they learned through Text4baby. So it's keeping that conversation going, so the providers are very involved in Text4baby and asking about it when their clients come back. So they've had a very high success rate in enrolling women through the WIC clinic. So just a really neat way to incorporate it in training, incorporating kind of the all-around health promotion that they're doing with their clients. So really exciting stuff going on there. So Text4baby, making a difference and more. Just to kind of give you an overview, and again, I could provide more information after the webinar, but just showing so far, what are we hearing not only anecdotally, but through studies that we're doing ongoing with the Text4baby program. So Text4baby is reaching its target audience. We're able to look at census-level data and show that not only are we reaching women in high poverty areas, a higher percentage of Text4baby users live or when they enrolled in zip codes with the highest levels of poverty compared to the overall U.S. distribution. Very positive to hear this, as well as we are also signing up women early on in their pregnancy. So 46% have enrolled in the first trimester. Also extremely positive to learn this. We want to get women enrolled as early as they can so they're getting as much information through the service. Users are liking the service. 95% who responded to a survey of over 25,000 said they would refer Text4baby to a friend. WIC participants in an Emory University study, 99% had no concerns about enrolling. 95% reported the enrollment process was easy. That's really good to hear. 92% regularly read Text4baby messages and plan to use Text4baby, as well as a service, some information that we've gotten from University of California. Cal State University study demonstrated that Text4baby is increasing mothers' health knowledge, appointment attendance, immunization adherence, interaction with providers, as well as access to health resources. So very positive information that we got from that study, as well as the George Washington University evaluation showing 3 times more likely women feel that they believe that they were prepared to be new mothers. That just resonates with me as far as that they feel prepared. I mean, that's a huge uneasiness with moms and making sure that they have all the information they have while they're pregnant, and showing that this service gave them that knowledge and preparation while they were pregnant. And then here's some quotes of users throughout the U.S. So I mentioned earlier we already have messages around Medicaid and CHIP and giving them more information to apply in health coverage, but we've additionally added in kind of some questions around asking about, do you want to get more information around free and low-cost health insurance, as well as what type of health insurance do you have? Of those who do not have health insurance, we were able to have some further interaction with them about giving them information if they're eligible to apply for Medicaid and CHIP, and then we were able to ask if they were able to apply for free and low-cost health care. So really interesting information we're able to receive about our user base, as well as continuing to give them this information. Text4baby is an interactive tool. I keep mentioning this. In October 2011, I talked about the flu module that we implemented, and we're continuing to do this every year, getting a really great response rate, as well as interest in receiving text messages to remind them, and then understanding the obstacles in receiving a flu shot. And then just to wrap it up, I've mentioned a variety of ideas, and I know that in your proposals you included ideas around what you're going to be doing in your community, but just some other ways that both on the national level, state level, local level, our partners have had a lot of success. So here's some really great ideas that they've just integrated it in the work that they've been doing. So for example, Virginia FAMIS, the Children's Health Insurance Program, they included Text4baby in welcome letters to new moms and back of business cards. Idaho Department of Health and Welfare with the Idaho Medicaid Department sent letters to all pregnant Medicaid recipients, resulting in over a 1,400% increase in enrollment. This was fantastic, blew us away. We think because it's on the bottom of your screen in the middle, you see this is Idaho Department of Health and Welfare right here. This is what their letter looked like. Because it was a mailing with just this information, we think that's what really brought attention to when the Medicaid recipients received this mailing and helped with increasing enrollment. So they're continuing this effort. They're doing this mailing every 6 months, so fantastic work there. Florida Covering Kids and Families sent out letters about health insurance with Text4baby information on envelopes. New York City Department of Health and Mental Hygiene and the Department of Vital Statistics included buck slips in every birth certificate mailing. So another fantastic way to just include Text4baby on a lot of the work that these partners are already doing. And this is even getting to another level of institutionalizing Text4baby in states or communities. San Diego County has worked with this online support service website where women can enroll in a number of social and support and health services at once called One EAP, and the Text4baby enrollment link was included. We've had the Oklahoma Healthcare Authority start initiating the process of adding a Text4baby link to their Sooner Care application, and then a number of other ways that they've been able to do this. But this is long-term ideas. And going back up here, these are more state level. But if you do work with the state health department, or you can do this on a state level. But again, you could do this in your local city or county health department or whatever entity you work in. So just other ideas in addition to what we've spoken about earlier. And then again, just within the WIC clinic and working with WIC clients, just some other ideas of just working, when you are in the community, just signing up on the spot, working with them to sign up, just, making sure it actually happens. And if at an event you say, go sign up later, it might decrease their chances. So just having it happen right there on site within the activity you're doing, distributing our free promotion materials, sending emails to staff, as well as, again, staying up to date with Text4baby Tuesday is a great way to get new ideas for you and just think of other ways to engage your community. And that is my presentation. So thank you again. I'm really happy to be participating today. And again, I'm supporting you all as the Kansas Outreach Coordinator. So as Cristi will provide information at the end, I will continue to help you all as you are promoting Text4baby.
Lindsay, thank you so much for the great presentation. What wonderful resources you have available for us. So I'm sure that many of the people on the phone got some excellent ideas for things to pursue in addition to what they've already proposed. And we did have a couple of questions that came in that I just wanted to go over with you before we start talking about the Kansas Minigrant project. One was, if someone is interested in accessing the electronic files like the logos, should they just send you an email, or what's the best way to access those?
Is my audio on, Cristi?
Yes.
Okay, great. Yes, that's exactly right. Have them just email me directly, and I'm more than happy to share the customizable files with them, as well as the logo as well.
Okay, perfect. And then you also talked about dads a little bit, that dads could sign up for Text4baby in order to get the information. We had the question that came in, what about dads? Is there anything else in the works for dads, or could you talk a little bit more about that?
Sure. It's a great question. Again, from the beginning when we first launched the Text4baby service, we've been receiving feedback, this is wonderful for moms, but it's really important for dads to also know the process and know what mom's going through. So just like with moms signing up, dads can sign up the exact same way. When they sign up for the service, they can just put in their wife's due date or date of birth if she's already had the baby and follow along with the information she's receiving. That will be really important for dads to know, whether it's understanding a little bit what their wife's going through, but as well as getting more information to keep their mom and the baby healthy throughout the pregnancy, where to get more information, who to talk to, what to become prepared when meeting with their providers, with their prenatal appointments, and then after they have their baby. As I mentioned, we've included recently, we launched this around Father's Day, and we've included just some more specific information just focusing on dads. So again, all the information is useful and exciting for dads to be getting as well, but we've been trying to add more information when we can, focusing on the dad audience. So yeah, that's a really neat feature. And this was a very interesting question I wanted just to mention that somebody asked on the Friday webinar, one of the award recipients, saying, when you have a provider, for example, sign up for the service, why do they have to give a due date even though they're a provider? Well, the reason they have to do that is we have to know where they are in their quote-unquote pregnancy or after they have their baby, so we know when to send those messages. So for providers, somebody that's interested in seeing the messages, if one of you all wants to sign up just to see the messages, you do have to put in a due date because, as I mentioned, the messages are timed to a due date. So it's best to put it as far back away from the 9 months, just so you can see the full gamut of our messages, and then you can give, you can update it when you have your, fake baby, just so you can receive these messages. But yes, you will have to enter it in, even if you are just a provider or an observer.
Okay, great. Thank you so much. And I will anticipate that there will be more questions for you. So
Sure.
Thank you for staying on the duration of the webinar, and we will have a question and answer session at the end. Right now,
Sounds good.
to talk a little bit about the Kansas Mini Grant project, and those of you who are on this webinar are successful Mini Grant applicants, and so we really appreciate your interest in this project, and I just wanted to provide a little bit more information. It is funded by the Early Childhood Advisory Council, and it's coordinated by Kansas Project Launch. There was a total of a little over $40,000 awarded. We had 53 applicants, which we were very surprised that there was such a great interest in this, and so it was very exciting. And your funding will be distributed within 30 days of receipt of your W-9. I have most of your W-9s back, and so if you haven't sent in your W-9, please do that as soon as possible, and then just be a little patient because it is going through KU, which is a bureaucratic organization, as I'm sure many of you are used to dealing with. So hopefully we will get it to you as soon as we can so that you can get your great project started. The next thing I wanted to show you is a map showing where the awards were given, and you'll see the pink star in Finney County, and Finney County is actually where we started Text4baby efforts as part of Kansas Project Launch a little over 3 years ago, and we're really fortunate to have Katrina Lowry on the phone with us, and she's going to talk a little bit about some of the efforts they implemented in Finney County to give you some across the state with communities that applied. And so I would suggest that if you see a neighboring county that received a mini grant, it would be great if you could communicate with them, and I'd be happy to provide contact information for awardees if there's someone you'd like to connect with, and maybe combine resources. So that might be something that you consider as well. These are some of the different ideas that are being implemented by our Kansas mini grantees. Lots of different community events like baby showers and health fairs where Text4baby will be the star of the show, if you will. Some great ideas. One is, if people sign up for Text4baby, they get a raffle ticket to win some prizes. There will be promotional information and items distributed throughout communities. Physicians' offices are required, if you'll keep that in mind. And then one community came up with the idea of having a competition between physicians' offices to see who could get the most Text4baby signups. There is also the creative use of websites and social media, as well as movie theater slides, which was a really successful strategy in Finney County that Katrina will talk about, as well as the use of public service announcements for radio and television and promotion of the programs through programs that are already visiting pregnant women and new moms, like home visitation programs, breastfeeding, and other programs. Electronic billboards as well are a great idea, and then one community is having an in-service for key providers to provide them with Text4baby information. So all great ideas. Lindsay mentioned that we are going to be providing some assistance with Text4baby evaluation, and what we're going to do is track the monthly enrollment in communities that have Text4baby funding as opposed to those that did not receive, either if they didn't apply or didn't receive funds. And so we're going to look and see, if there's a difference, if the funding made a difference as far as getting women to sign up for Text4baby. And if you're interested, we would have people who could explain in detail the evaluation plan. We're also going to track the number of organizations that sign up as partners with Text4baby, and they are featured in Text4baby Tuesdays. We've definitely seen an increase in the number of Kansas partners. Last week's was, there was a long list of Kansas partners, and we were the only state that had people sign up last week, and then this week there were, several as well. So would definitely encourage you to sign up if you have not already done so. This is just a look at one graphic that was completed by our evaluation team looking at Text4baby enrollment in Finney County, which did have funding and efforts dedicated to looking at that. And I can't see my legend because my go-to meeting was in the way, but Finney County is kind of the pinkish purple line. And then you can see the comparison counties were Seward and Ford, as well as all of Kansas. You can see that when Text4baby first started in the second quarter of 2010, there was a huge jump in women who signed up, of course, and then it kind of trailed off over time. And then when the efforts were in place, you could see the fourth quarter of 2011 and the first quarter of 2012 was when they implemented some of the public awareness strategies that Katrina will talk about. And so you can definitely see an increase in numbers of women who signed up. So resources and reporting, obviously Text4baby.org and Lindsay are great resources for us, so we're really excited to have that available. We also have business card-sized information from KDHE, and we are fortunate today to have Joe Kotsch, who is from Kansas Department of Health and Environment, on the line, and I'm going to see if we can turn the call over to him for just a moment. Joe, you should be unmuted, so if you would like to say a few words about the business card and any other resources you'd like to share, that would be great.
Can you hear me?
Yes.
Okay, good. I'm coming through. That's great to know. First of all, I would just like to start out by saying that I've just been impressed from the very get-go with Kansas partners coming on board just as we first announced it in 2010, And working with Cristi's just been a joy, and with Lindsay and all the folks at the Healthy Mothers, Healthy Babies, it's been an excellent experience. I did participate actually as not just a father but as a grandfather in the program myself, and that's where I learned what those messages were and what the timing was, and had a true feeling for the program, and was able to see, because I was still on it, I believe in 2010 and a little bit into 2011, I timed it according to my grandson's birth. So I got to see some of what Lindsay and you all have mentioned already in terms of resources and the greater interactivity of the program. So kudos to all, and thank you all for the new partners who have signed up as well. I always refer to this in meetings I go to, at least, as the Kansas Text4baby partnership. So it's kind of it's just another way of promoting the program and breathing a little more life into it and making it real to more people. And that's what I encourage as one of those strategies. Use the business card, and that's where it comes in handy as you go to meetings or as you're working with mothers and parents. It's important to give each one a card and just introduce them to it. Also, if you're comfortable with it, or once you get comfortable with the program itself, it's very easy. I've done this in airports, and I didn't really care where I was. It's more than about Kansas. It's about all moms and babies and good health. So you can just literally pull out your cell phone and say you can sign up this easily, or show them, if you've already signed up as I had, show them the actual messages that you've received. And I saved so many I ran out of room in my texting program on my telephone. So I mean, it really is wonderful. I can't say enough good things about it. And to absolutely take full advantage of what Healthy Mothers, Healthy Babies has available in the Text4baby items they offer, whether it's web banners, tear pads is what I'm currently using, and I have just received a couple boxes of those, and a variety of some other information just good about maternal and infant health. And right now I'm down to about I think I counted around 4,500 to 5,000 Text4baby business cards, and you can contact me anytime to inquire about it, whether it's through Cristi or any other means you have of getting hold of me. Some of you I recognize as partners in our Maternal Child Health Block Grant program, and again, that's a wonderful way to promote it, and we're integrating this actually into what we do as part of our services, and it's great to see more and more of those types of partners come on board. I bring it to the attention of various advisory councils, and they're looking at it as a very positive approach, a very positive thing to use in Kansas as well. Can't say enough about local advertising. Word of mouth is the best advertising, just in case no one's ever said that to you in your life, but I really believe in that one. That personal touch goes so much further. And as Cristi mentioned, those community baby showers, meeting the moms face to face, that really, truly is powerful. And I thank you for all your good work.
Thanks so much, Joe. We really appreciate you being on the webinar today and appreciate all the support from the state of Kansas for our efforts. One thing I did want to mention is that everyone's email who you are hearing from today, I have a slide at the end with our email addresses, so you'll have access to those, and you'll actually also receive some information from me. I am going to be sending out a copy of the PowerPoint from today's presentation, as well as a link to the recording of the whole webinar so that you can hear the audio as well if you'd like. If you have someone else on your staff you'd like to have the information, you will have the opportunity to have them listen to that recording. So I wanted to let you know that those are available as well. So you will have everyone's email so that you can contact us as you need to. A couple of other things I wanted to let you know is that a press release, a statewide press release, went out today, and so you might be getting questions from media regarding the efforts in your community. There is also a customizable press release that I'm going to be sending out hopefully today that will give you information, and then you can just plug in your own community name and what efforts you are going to be doing. So it should be something that could get you going to where you could send it out to your local press really easily. And as Lindsay said, we're available to provide assistance to you. So please just let us know if there's anything you need. If you want to brainstorm ideas, we're available to do that. So please utilize the resources that you have. And we also mentioned that we will be assisting with evaluation. If you have ideas for a more detailed evaluation that you'd like to do with your community, our evaluation team can help you with that. And for those of you who are afraid of evaluation, I think the reporting aspect of this mini grant opportunity threw some people for a loop as far as being intimidated. And I just wanted to let you know it's really simple. We will be sending out a reporting form, but what we're looking for is just for you to track any event dates that you have, numbers of people, a general description of what took place, and numbers of items that you distributed. And if you could let us know about your events in advance, we'd really appreciate it because, if at all possible, some of us might like to attend the event. If that is not possible, then we would definitely like you to take pictures and forward those to us if that's possible. And so with that, I'm going to turn it over to Katrina, who's going to talk about their efforts in Finney County.
Hey, everybody. This will only take a few minutes. I'm sure that you are hoping to be able to go to lunch soon because if you're like me, you're getting a little bit hungry. But I just wanted to talk briefly about some of the things we've done in Finney County. I know some of you live in or around this area, so you may have seen some of these things. Some of you maybe not. So one of the things we did is this billboard that you're seeing. It's not a great picture, but this billboard, we are in Finney County, and the billboard is actually in Ford County. And the reason for that is that when we decided to do a billboard, there was nothing really centrally located in Finney County. And so we looked at what was available, and we decided this is on the highway between Garden City and Dodge City. And there are a lot of people who travel back and forth between Garden and Dodge for work or for shopping, for different things, and we decided that this would be a great way to reach people from Finney County, but also from Ford County and other counties who might be traveling. And we have had a lot of success with this in the movie theater slide, which you'll see in just a minute, but we're hoping that people who are passengers in the cars are the ones texting to get the text messages. As my very own mother pointed out, she said, you're telling people to text while they're driving. And I thought, well, that's a good point. So I said, well, I hope it's the passengers who are doing the texting. But we have had success with this billboard. And then this is the movie theater slide that we have been using in Finney County. We have a one movie theater, but it does have 8 screens. And so this plays in a rotating slideshow before the movie in every single theater in that theater, every single screen. And we had a local artist / graphic designer design this for us using the Text4baby materials that Lindsay talked about that you will have access to. And she put it together for us, and we have been able to run it for almost 2 years now in the local movie theater. So that has been very successful. I know that there are some of you who might be interested in using this, and that is definitely doable. If you are interested, you can contact me, and I will give you the contact information for the graphic designer. She is happy to work with you. She basically will charge a small fee to change where it says Finney County Community Health Coalition to change it to your local organization. So that, she's happy to do that. She's very talented and very easy to work with. And after we did these 2 things, the movie theater slide and the billboard, as you remember from the charts that Cristi showed earlier, we saw a huge spike in enrollment for Text4baby. So we feel like these 2 things were really effective at reaching out to people, and we feel like we're reaching, with the billboard being in Ford County and the movie theater slide, we have a lot of people coming to town to shop, to go to movies, different things. So we feel like, we hope we're reaching people from many different communities, not just Garden City, but also just, reaching a lot of people in Garden City and a wide variety of ages, because a lot of people go to movies and a lot of people drive. This is something else we did. We have 2 Dillon stores in Garden City, and we purchase advertising on their pharmacy bags. So basically, anyone who goes to get a prescription from one of our Dillon stores gets this on the side of their prescription bag. So it's really a cost-effective way to advertise. I don't remember the cost right off the top of my head, but it's not very expensive, and they basically look for sponsors for bags. It's either once a quarter or twice a year, and you pay so much money for, you know, what size ad you want. And ours isn't huge, but it's still, I mean, it goes home with every single person who's filled a prescription. So this has been a successful advertising strategy as well. And then this is the other thing that we've done in Finney County. As Lindsay mentioned, pretty much everything you can get from Text4baby is in English and Spanish, which is amazing, and which covers a lot of the languages spoken in Finney County. But we also have had a large influx of Somalian refugees and Burmese refugees over the last several years. So about 3 years ago, 3.5 years ago actually, they had a flyer that we had put together for Text4baby translated into Somali and into Burmese. So we've expanded the languages it's available in. Now, obviously, the text messages aren't in those languages, but what we are learning is that some of these people really, I mean, considering how well I would do in their language if I was trying to learn it, they do quite well in English. They're just not very confident in their skills. So hopefully they're able to read the text messages they're getting, or they're finding someone who can help them read them, and that it is valuable to them. But we've tried to reach out that way, and who knows, maybe someday they'll be able to access it in their own language. We have so many languages here in Finney County that it's always a challenge, and one that we try to undertake, but it's always a challenge to get everyone the resources they need in the languages they need it in. The other thing I was going to mention is that as we've worked with Text4baby, we have tried to just reach out to multiple community partners. We've reached out to doctors' offices. We've reached out to our health department, our WIC, home visiting, early intervention. We've worked with several different agencies to get this information out there. And so anybody you can think of, just try it. I know one of the other things we want to do is see if we can leave the Text4baby care pads at our local pharmacies, and maybe even with our local cell phone providers. Since so many of these cell phone providers are participating in for women to get these, well, and men, to get these free text messages, our thought was, well, wouldn't they want to promote this good that they're doing? So that is the other idea we've had. So those are some ideas to pass along to you, and I'm looking forward to see all the exciting things you do. It was fun to see all the ideas that were presented. Thank you.
Thanks, Katrina. We really appreciate all of the great work that Finney County has done, and your role modeling for so many other communities. So we definitely appreciate you participating. With that, you can see the final poll for the webinar, which is that I think Kansas will win the national contest. And so it looks like a little over half of you have voted. Okay. All right, I am going to go ahead and close the poll and share the results. We had 93% of you who said yes and 7% no. So definitely, for the most part, many of us think that Kansas can win. So we're looking forward to that opportunity. At the webinar we had Friday, we had 100% yes. So lots of positivity regarding the contest. And so this is the contact information. And again, I'll be sending out this PowerPoint to all of you, so you don't have to rush to copy down the contact information, but just emails for any of us. We're, again, very willing to help you with anything that you need. Anything specific about the Minigrant program, like someone asked about their W-9, then please send that directly to ccain@ku.edu. I just realized that you cannot see the contact information right then because I still have the poll up. So now you should be able to see it. And I'm just going to check real quickly for questions. So if you have a question, type it into the question chat box, and we can answer those real quickly. I believe Lindsay had to step off the line. So if you have any questions for Lindsay, we'd be happy to send those to her, and then we can send the answers out to the whole group. But does anyone have any questions before we sign off the webinar? I'll give you just a minute to type those in. Joe, Katrina, anything to add before we sign off?
No, not at this point, other than just to kind of generally say thank you again, one and all who participated today and who are joining in on our efforts as this all goes forward.
Thanks so much, Joe. And Joe, Katrina, and Lindsay, if you're still on, we really appreciate your time and your support for this effort. Joe and Katrina both served on the review committee for the mini grants, and so a lot of work has gone into this, and we're so excited to see the work that goes on in your community. So definitely keep us posted, and best of luck, and please use us as resources. So with that, I don't see any other questions that came up. If questions do come up, please, you can go ahead and just email me at ccain@ku.edu, and I will get the answers for you. So with that, thanks so much. Go enjoy your lunch and have a great week, and best of luck with the Text4baby efforts, and we'll look forward to talking to you soon. Thank you.